We are on top of breaking news at this hour. Jimmy Carter, former U.S. president, in Emory Hospital right now in Atlanta.
We have learned that he will have a procedure to relieve pressure on his brain, and that surgery will happen tomorrow morning.
Dr. Daria Galipsy is on the phone right now. Dr. Galipsy, you are an ER doctor. You do not treat the former president, but you do run a website, drdaria.com. The former president was just admitted today, and apparently he's having some type of brain procedure to stop the bleeding on his brain. What typically involves a procedure like that?
Yeah, that's a great question. And we know that he's had multiple falls over the past, several months. He probably has something called a subdural hematoma, which they're going to go in and depending on the size of it, again, as you mentioned, I'm not treating him, we can't say. He'll either have a surgery called a craniotomy, or they'll actually just make small holes to drain the blood out of the brain.
The president is 95 years old. What type of risk would this involve for him with his health? He's had surgery as recently for a fractured pelvis back on October 21st. Is he strong enough to handle this type of surgery, and is there any dangers involved?
Well, that's an exceptional question, because any procedure, there are always dangers involved, and especially with the bleed he likely has, since he, from what we know, he hasn't had a fall in a couple of weeks, so it's probably a slow-growing bleed. And in people, 70, 75 and above, we try to wait. We try to see if their brain will absorb the blood itself, because you really don't want to take them to any form of surgery to try to relieve it. You hope their body can heal it on their own. The fact that they're taking him to surgery means that his body wasn't absorbing it.
Dr. Gillespie, we've heard about these multiple falls. Could those falls be related to something going on in his brain? Could this problem that he's having now and this procedure that they're going to give him tomorrow to try to alleviate that, could that be the reason why he's been falling so frequently?
That could. It is more. It's possible. It's more likely that these frequent falls have led to this bleed. As we get older, the brain starts to shrink a little bit, and so it makes it easier. Every time you have a fall, you can imagine it kind of bounces back and forth. It increases your risk of bleed. So that's the most likely cause. But it's possible when somebody has a bleed inside the brain, it causes them to not be able to think as clearly, to not be able to react as clearly. They feel lightheaded. They feel sleepy. That itself could contribute to falls.
The Carter Center, Dr. Gillespie, has released a statement on Twitter saying that the former president is resting comfortably with his wife, Rosalind. She's with him. Could this be interpreted as a good sign that he is awake, that he knows what's going on around him, and his wife is with him?
That absolutely is always a good sign. And we're not hearing that they're rushing him to the OR tonight, which means that this is probably one of those subacute, meaning it's just slowly progressive kind of bleeds. They've noticed that it's getting worse. It's not getting better. So they're going to treat it likely. They don't want to wait until it's too late and then it's an emergency. They want to nip it in the bud and try to get it resolved. So that's a good sign, and we can all really hope for the best.
Yeah, we are certainly hoping for the best. I mean, the president is 95 years old, and just recently at his church in Plains, Georgia, he had stated to his Sunday school class that he was at peace with death. And nobody wants this to happen, but even the president seems to come to terms with the fact that he is older, and he wants those who love him and those around him to know that regardless of what happens, he's at peace.
I think that's so wonderful. That shows a strength, and it shows he wants that quality of life, which is what I think we all want, which is really what makes up the beauty of life.
Final question, Dr. Gillespie. We've seen this former president, bounce back very quickly from some of his more recent injuries. I think it was only days after having surgery that he was back teaching that Sunday school class that Sean was just talking about. What kind of a recovery could he be looking at if the procedure that he's having tomorrow is what you suspect it is?
Well, it's hard to say, again, not knowing if it's going to be just the minor procedure, if they're going to have to be a larger surgical procedure. So it really depends on which of those they're going to be having to do. Even if it's a minor, they end up having to put in a drain and monitored and things. But I think, as you mentioned, he has shown us that he bounces back quickly, whatever happens to him. So I think he is a baseline good health and strength, which always bodes well for anybody, despite the risks of any surgery.
Well, Dr. Daria Gillespie, an emergency medicine physician, not treating the former president, but certainly knowledgeable of what patients like him are facing. We appreciate your insight. And for those of you who are just joining us, just to recap, the former president has been admitted to Emory Hospital in Atlanta. According to a statement that just came out from the Carter Center, he will be treated with a brain procedure tomorrow to alleviate the pressure on his brain from bleeding on his brain due to falls that he had. The most recent we've been able to get is from May 14th, 10/6 and 10/21, the most recent. We're going to continue to follow the story and have the very latest on our website at cbs46.com.